Love hiking but hate how you feel afterwards? You're not alone, and what's happening to your feet is worse than you think. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. I often see hikers who come into my office with preventable foot injuries that could have been avoided with the right knowledge. The truth is that most hikers are unknowingly damaging their feet with every step they take on the trail. In today's video, I'm going to reveal the 5 biggest mistakes hikers make that destroy their feet, the early warning signs that you need to watch for, and most importantly, the simple strategies to keep your feet healthy for years of hiking adventures. You'll learn about proper footwear selection, blister prevention techniques, and how to recognize when your foot pain signals a serious problem. But before I do, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps other hikers find this crucial information. And I post new videos every week with important foot health content. Most hikers think foot pain is part of the experience. They accept blisters, sore arches, and aching heels as the price of enjoying the outdoors. This couldn't be further from the truth. Your feet should feel good during and after hiking, and when they don't, it's a sign something is wrong. The problem is that hiking puts unique stress on your feet that your daily activities don't. You're walking on uneven terrain for extended periods, often carrying extra weight and dealing with environmental factors like heat, cold, and moisture. Without proper preparation and knowledge, these stresses can lead to both acute injuries and chronic problems. What makes this even more concerning is that many hiking-related foot problems don't show up immediately. You may feel fine during your hike only to develop pain, swelling, or other issues hours or days later. By then, the damage is already done, and you're dealing with an injury rather than preventing one. The 5 biggest mistakes hikers make that destroy their feet represent the most common problems I see in my practice. Understanding these mistakes help understand why so many hikers struggle with foot problems and what you can do to avoid them. Mistake number 1 is wearing the wrong shoes or boots for hiking. This seems obvious, but the reality is many hikers are wearing footwear that's completely inappropriate for the demands of hiking. The most common error is we're wearing running shoes or casual sneakers on hiking trails. Running shoes are designed for forward motion on relatively smooth surfaces. They don't provide the lateral stability needed for uneven terrain, and they often lack the durability to withstand the abrasive conditions found on hiking trails. The result is increased risk of ankle injuries and premature shoe breakdown. Another common footwear mistake is choosing boots that are too stiff or too flexible for your hiking style. Boots that are too stiff can cause pressure points and restrict natural foot mesh movement. Boots that are too flexible don't provide adequate support on challenging terrain. The wrong size is perhaps the most damaging mistake of all. Many hikers wear shoes that are too small, not accounting for foot swelling that occurs during long hikes. This leads to black toenails, blisters, and significant discomfort that can ruin your hiking experience. Mistake number 2 is ignoring proper sock selection and foot preparation. Many hikers focus extensively on choosing the right boots, but give little thought to what goes on inside them. Your socks are just as important as your boots for preventing foot problems. Cotton socks are one of the worst choices for hiking. Cotton retains moisture, loses its cushioning properties when wet, and creates the perfect environment for blisters and fungal infections. Yet, many hikers continue to wear cotton socks because they're comfortable for everyday activities. Failing to prepare your feet for hiking is another critical mistake. Your feet need to be conditioned for the demands of hiking, especially if you're planning longer or more challenging hikes. Jumping from sedentary activity to long hikes without proper conditioning is a recipe for injury. Not addressing hot spots early is a mistake that turns minor irritation into major problems. Hot spots are areas of friction that develop during hiking and are precursors to blisters. Experienced hikers know how to stop and address hot spots immediately, while novice hikers often try to push through discomfort. Mistake number 3 is poor hiking technique and biomechanics. How you walk on the trail has a huge impact on your foot health. Many hikers use the same walking technique they use on flat surfaces, which is inefficient and potentially damaging on hiking trails. Improper foot placement on uneven terrain increases your risk of ankle sprains and other injuries. Many hikers look at the scenery instead of watching where they're stepping, leading to missteps that cause serious injury. Not adjusting your gait for different terrain types is another common mistake. Walking uphill, downhill, and on different surfaces require different techniques to minimize stress on your feet and legs. Hikers who don't address this technique often develop overuse injuries. Carrying too much weight without proper conditioning puts excessive stress on your feet. Every extra pound in your pack multiplies the stress on your feet over the course of a long hike. Many hikers carry unnecessary gear that significantly increases their injury risk. Mistake number 4 is inadequate foot care during and after hiking. Proper foot care doesn't end when you put on your boots. It continues throughout your hike and afterwards. Many hikers neglect this aspect of foot health, leading to preventable problems. Not checking your feet during long hikes is a critical oversight. Regular foot checks allow you to identify and address problems before they become serious. This is especially important on multi-day hikes. During these hikes, small problems can quickly become major issues. Ignoring pain or discomfort is perhaps the most dangerous mistake hikers make. Pain is your body's warning system, and ignoring it often leads to more serious injuries. Many hikers have the tough it out mentality that causes minor problems to become major ones. Poor post-hike foot care allows problems to develop or worsen after your hike is over. Your feet need attention after hiking, including proper cleaning, inspection, and care of any developing issues. Mistake number 5 is not recognizing when foot problems require professional attention. Many hikers try to self-treat serious foot problems, often making them worse in the process. Knowing when to seek professional help can prevent minor issues from becoming major problems. Attempting to treat serious injuries with home remedies is a common mistake that can lead to complications. While minor issues like small blisters can often be managed at home, more serious problems require professional evaluation and treatment. Not understanding the difference between normal post-hike soreness and injury symptoms leads many hikers to ignore serious problems. Some discomfort after hiking is normal, but certain symptoms always warrant professional attention. The hidden damage that accumulates over time is something many hikers don't consider. Repeated stress from poor hiking practices can lead to chronic problems that develop gradually over months or years. These problems are often more serious and harder to treat than acute injuries. Stress fractures are one of the most serious hidden injuries that can develop from repeated hiking stress. These small cracks in bones often don't cause severe pain initially, but can progress to complete fractures if not properly treated. Chronic tendon problems can develop from repeated stress and poor biomechanics. Conditions like Achilles tendonitis or posterior tibial tendon dysfunction can become chronic problems that significantly limit your hiking ability. Joint wear and arthritis can accelerate from repeated stress on improperly supported feet. While some joint wear is normal with aging, poor hiking practices can accelerate this process and lead to premature arthritis. How to save your feet and hike safely involves implementing proper strategies for footwear selection, foot preparation, and hiking technique. These strategies can prevent most hiking-related foot problems to keep you on the trails for years to come. Proper footwear selection starts with understanding your foot type and hiking style. Different foot shapes and hiking preferences require different types of footwear. Getting properly fitted by knowledgeable staff at a specialty outdoor retailer is crucial. The importance of trying on boots later in the day cannot be overstated. Your feet swell throughout the day, and boots that fit in the morning might be too tight in the afternoon. Always try on hiking footwear when your feet are at their largest. Breaking in new boots gradually is essential for preventing problems. New boots should be worn for short periods initially, gradually increasing the duration and difficulty of use. Never wear brand new boots on a longer, challenging hike. Sock selection and layering techniques can make a huge difference in foot comfort and blister prevention. Moisture-wicking synthetic or wool socks are essential, and many hikers benefit from using liner socks underneath their hiking socks. Foot preparation and conditioning involves gradually building up your hiking distance and difficulty. Your feet need time to adapt to the stresses of hiking, and rushing this process often leads to injury. Strengthening exercises for your feet and ankles can help prevent injuries and improve your hiking performance. Simple exercises like calf raises, toe curls, and balance training can significantly improve your foot strength and stability. Proper hiking techniques include learning how to walk efficiently on different types of terrain. This includes proper foot placement, using trekking poles effectively, and adjusting your gait for uphill and downhill sections. The importance of taking breaks and checking your feet during long hikes cannot be emphasized enough. Regular breaks allow you to rest, hydrate, and inspect your feet for developing problems. When to seek professional help includes persistent pain, swelling, or other symptoms that don't resolve with rest. Early intervention can often prevent minor problems from becoming major ones. Warning signs that require immediate attention include severe pain, significant swelling, inability to bear weight, or signs of infection. These symptoms always warrant prompt medical evaluation. The long-term benefits of proper foot care for hikers extend far beyond preventing immediate problems. Good foot health allows you to continue hiking as you age and help prevent chronic problems that could limit your outdoor activities. If you found this information helpful, please share this video on social media. Your simple share can help a fellow hiker avoid serious foot problems and continue to enjoy the trail safely. Also, leave a comment below if you have any questions about hiking foot care. I do my best to respond. If you're experiencing persistent foot problems from hiking, or if you want to optimize your foot health for better hiking performance, don't wait to get professional help. Schedule an appointment for a comprehensive hiking foot evaluation. We can assess your specific needs and develop a plan to keep your feet healthy for all your outdoor adventures. The link to schedule is in the description below. Thanks so much for watching, and have a great day.